Hello and welcome. Today, we're diving into a true oncologic emergency, a condition where the success of cancer treatment can paradoxically lead to a life threatening crisis. This is Tumor Lysis Syndrome, or TLS. It's what happens when cancer cells explode, and understanding it is critical for anyone in healthcare. Let's get started. So, what is tumor lysis syndrome? At its core, TLS is a severe metabolic complication that happens when a large number of cancer cells are rapidly destroyed, or lysed. As these cells break open, they dump all of their internal contents into the bloodstream. This happens so quickly and in such large amounts that the kidneys, which are our body's filtration system, simply can't keep up. This sudden flood of electrolytes and metabolic waste products completely overwhelms the body's ability to maintain balance. While it can rarely happen on its own in very aggressive cancers, it most often occurs within hours to days after starting chemotherapy or another effective cancer therapy. To understand TLS, you have to visualize what's happening at the cellular level. First, an effective cancer treatment, like chemotherapy, starts rapidly killing off malignant cells. As these cells die and rupture, their internal contents spill out into the blood. This includes high concentrations of potassium, phosphate, and nucleic acids like DNA and RNA. These nucleic acids are then metabolized by the liver, which turns them into a waste product called uric acid. The result is a sudden massive load of potassium, phosphate, and uric acid flooding the bloodstream, and the kidneys are put under immense pressure to clear it all. This intracellular flood creates a classic and predictable set of lab abnormalities that are the hallmark of TLS. You need to know these four key derangements. First, hyperkalemia or high potassium. Second, hyperphosphatemia or high phosphate. Third, hyperuricemia or high uric acid. And finally, hypocalcemia or low calcium. Now, you might wonder why calcium is low when everything else is high. This is a crucial point. The excess phosphate that's released into the blood binds with free calcium, forming calcium phosphate crystals. This process effectively pulls usable calcium out of circulation, causing the level to drop. These lab abnormalities aren't just numbers on a page. They have severe consequences for the patient. The hyperkalemia is the most immediate threat to life, as it can cause fatal cardiac arrhythmias and cardiac arrest. The hypocalcemia, or lack of calcium, leads to neuromuscular irritability, which can manifest as muscle cramps, involuntary spasms known as tetany, and even seizures. Finally, the high levels of phosphate and uric acid are a direct assault on the kidneys. They form crystals that precipitate in the renal tubules, essentially clogging the kidney's filtration system and leading to acute kidney injury, or AKI. A key part of managing TLS is identifying which patients are at high risk before treatment even begins. The risk is highest in cancers that grow very quickly and are highly sensitive to chemotherapy, meaning the cells will die off rapidly. Classic examples are Burkitt's lymphoma and acute leukemias like ALL and AML. A high tumor burden, meaning a large amount of cancer in the body, such as bulky tumors or a very high white blood cell count, also dramatically increases the risk. Finally, patient-specific factors like pre-existing kidney problems or dehydration make a patient much more vulnerable to developing TLS. Because TLS is so dangerous, prevention is truly the best treatment. For any patient identified as high risk, a management plan is started before the first dose of chemotherapy. The single most important intervention is aggressive IV hydration. By giving lots of fluids, we increase urine output, which helps flush the excess electrolytes and uric acid out of the system and protects the kidneys. The second cornerstone is managing uric acid. We use medications like allopurinol, which prevents new uric acid from being formed, or respiricase, a powerful enzyme that breaks down uric acid that's already in the blood. If TLS does develop, the focus shifts to correcting the electrolyte imbalances and, in severe cases of kidney failure, providing support with dialysis. Let's quickly summarize the most critical points. Tumor lysis syndrome is a metabolic emergency caused by the massive and rapid destruction of cancer cells. The four hallmark lab values to remember are hyperkalemia, hyperphosphatemia, hyperuricemia, and the resulting hypocalcemia. The most severe, Life-threatening complications are cardiac arrhythmias from the high potassium and acute kidney injury from the uric acid and phosphate crystals. Finally, remember that the cornerstones of prevention and management are aggressive IV hydration and uric acid lowering agents. And that is your essential guide to tumor lysis syndrome. Thank you so much for watching. I hope this video helped clarify this complex but vital topic. If you have any questions, please ask them in the comments section below. If you found this helpful, please hit that like button and subscribe for more critical care and oncology content. Let me know what subject you'd like me to cover next. Stay safe and see you in the next video.